Well, the National Primary Healthcare Development Agency is the agency leading the response in COVID-19 vaccine campaigns across the country. And as of today, only a few states are in the lead, vaccinating at least half of its eligible population with a dose. It's still a long way to the 31st of March, a deadline of sorts for all states vaccinating 50% of its eligible population. And to talk more about this, joining us from Abuja studio is Dr. Nneka Onwu, the Director, Primary Healthcare Systems Development with the National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you. Good evening.
Good evening. First, is that date sacrosanct, the 31st of March, the deadline of all the states vaccinating 50%, or will there be an extension?
Thank you very much for that question. The country has set a target of achieving 70% of vaccination to achieve herd immunity by the end of 2022. And in the course of this campaign, we have a plan, a deployment plan, and one of it is ramping up, which we did as at the last phase from November with the mass vaccination. For this phase, we intend to also further ramp up and integrate with routine immunization. The plan is that the states should achieve 50% of their targeted population by March 31st. Based on our extrapolation, you will see that most of at least 2 states have achieved 50% and above, and some are almost there. So we believe that most states, with all hands on deck and with the plans and the deployments we have, we should be able to achieve that target. It's a target that we've set for everyone to be able to make our 50% and, of course, 70% by the end of the year. That's the only way we can protect our people. That's the only way we can keep them safe from having COVID infections. So, yes, that's a target that we have set based on what we are seeing.
When the agency also says 50% of its eligible population, what does it mean? Is it eligible population, the vulnerable priority groups, or adult population?
Yes, so when we started, we looked at the priority population. That was the phase 1. But now we're looking to 18 years and above. So each state, based on their population, we're looking at the eligible persons from 18 years and above. Those are the ones we are targeting for the state. So, of course, for each state, that population will depend on the total population of that particular state, those who are 18 years and above. So it varies, but we expect that, they should achieve 50% of vaccination for that target by 31st of March.
Following the review meetings and conversations on COVID-19 vaccination rollout across the country, I know that a team from the agency have been going around the country. What have you learned?
Well, as like most of the things we've learned from other vaccinations, polio, but the issue is around a lot of hesitancy. And I think overhead talking about, some like Bauchi, people are hesitant. And one of the things we have done is to also ramp up and provide that surge. And that's why you've seen us going around the states and the review meeting. There's a lot of dialogue at the community level. Using our traditional gatekeepers as well to, inform the people, because people are misinformed. Social media, people hear the wrong things. So we try to give them the right information from the right channel. So that's one of the things that, we are seeing, that, the hesitancy, but it's much better. And hesitancy is not, it's across the whole world. Globally, hesitancy around this vaccine has been, one of the challenges. But I think we are getting there. People are more aware, they have seen, and they've also then they were thinking, somebody's vaccinated will fall and die. Some said after 6 months, and they've seen people take the first dose, second dose, and booster, and we're all here. So I think that issue of hesitancy is being addressed, and moving forward, and with the surge and the cooperation of the states and the communities, and we will see more, reaching this target that we have. So that's a challenge, really, the hesitancy. We have the vaccines. We've had global support for the vaccines, so we have enough vaccines, and to give our people. And then identifying the sites, so we don't mass vaccination. Now people know where to get the vaccines, and so it's not the issue of not know where to get the vaccines. It's just more of hesitancy and getting people out there to come and take the vaccines that we have.
Some people have alleged, with the numbers being reeled out as to those who have been vaccinated, a number of public health practitioners have actually said that that number, which is over 16 million for the first dose, perhaps some have registered on the portal, but they've not actually had the jabs.
All right. So thank you very much. And for this vaccine, we've had a good opportunity to also have an electronic information system where, people are registered, and you get vaccinated. That is done. And we now validate the data, so to make sure that anything that you see on that platform is validated and as having been vaccinated. In addition, we have what you call the call-in data. So there are processes and mechanisms that we've set in place. Yes, we've heard about people trying to buy the card, but we've also stepped up in terms of, pursuing those people who have been found, to do that. But it's really minimal, and the country is looking at it. But I can tell you that, 16.1 million yes, have received their first dose because it's been validated, and of course for the second dose as well, and first, the booster dose. So those are the correct figures.
So looking at the pace of vaccination, I know the WHO Africa recommended countries doing sixfold, especially in Africa, to meet up with other parts of the world. What is the strategy for the National Primary Healthcare Development Agency?
I think most countries in Africa will be learning from us, really, because one of the things we said, like the phases, but bringing out the mass vaccination and expanding, even to other sides, the private facilities and pharmacies, and taking it to the community was one of our strategies, and it's worked. And a lot of countries are borrowing from that. And you can see between December and now how many people we have reached, based on this. So I think Nigeria has the experience. We have the vaccines. And based on the structures we've had, from the past, from polio, from other campaigns, the structures between the national, the state, and the local government is one that's been seamless, as well as the partners that support us. They've been with us. We know where the dead bodies are buried, as it were. So I think the country has the magic bullet, as it were, for this. Even going further to integrate with routine immunization is one of the things that we are looking at. We have done it, and we also need to get more children vaccinated. So pulling all this together, the mass vaccination, expanding the sites, private facilities, pharmacies, as well as other sites, that we can, the parks, the markets, and a community mobilization, intense community mobilization. Working with the communities is one of the things that we have as a game changer, and is working. And I think we will, with that, achieve our target by March 31st.
We appreciate your time on the program. Hope you can join us again in the future. Dr. Nneka Onu is the Director of Primary Healthcare Systems Development with the National Primary Healthcare Development Agency. Thank you for joining us on the program.
Thank you very much. It's always a pleasure to be here. Thank you.